Our presentation is just about an hour, so we want to definitely respect everybody's time this morning. And again, thank you all for coming through. I know that you want to be able to provide the best help for yourself. If you are a birthing mom or birthing parent, and also those of you who are birth workers, which I do see a few birth workers on the line, to be able to provide the best care for your moms and your families. So let's go ahead and get started. Again, I'm Dr. Akua Gray with A Life of Peace Wellness Institute, your instructor for today for water birth safety, ensuring a safe passage for mom and baby. All right, so the first thing that I always like to start off with, especially when it comes to the debates about water birth. One of my favorite sayings is WWND, which is what would nature do? Now, although most of us do know that water births are very beneficial in their own way, we do have to ask ourselves, and we do have to be aware of what would nature do. Now, because we are not water-dwelling beings, we are actually land beings. So us giving birth in water is not a natural thing. So let me put that out there first, because when we look at who we are in relationship to nature and how nature has designed us, we're actually supposed to be giving birth on land. But we know that we're smart and we figure out some things that make us a little bit more comfortable and bring a little more interesting things to our lives. So we do stuff, okay? We also were designed with a brain to make changes in our lives to protect ourselves and to help ourselves. So there is a difference between water labor versus water birth. Now, water labor has been documented in many cultures around the world, but water birth is actually a new phenomenon. So water labor among those in the natural birthing scene is really the most beneficial part of the birthing process concerning water, is water labor, because that will, of course, minimize the pain for mom. But then when you take it a little bit further and mom gets ready to birth and she gets that urge to push and she's still in the water, then that brings in another dynamic. And that's what we're going to talk about today, because a lot of women are choosing water birth. In fact, it is the fastest growing alternative birth method that is popular around the world today, okay? And it's not just in the US, it's everywhere. Even here in Ghana, where I'm talking to you from now, people are very interested in water births. And so by it being so popular, we have to educate ourselves on how to do this right. And that's what we're going to be talking about today. Okay. So let's go ahead and look at the research. Okay, we know we definitely want to bring the evidence into it of the who, the what, the hows, and the whys. In the West, the first time water birth was ever proposed in the medical industry was back in 1908. There was an article on it in one of the medical journals. So that was quite a while ago. Okay, however, Water birth as we know it today began to get popular in the 1980s and the 1990s. And it became controversial because when the buzz of water birth came into the 20th century, it was not what doctors were doing. So they came out with all kinds of negative things about why water birth is not good and, what the risks are and, the possibility of drowning and all of those things. But, fortunately, those in the natural health and the natural birth arena, they didn't listen to that because when they worked with mothers in water birthing, what they found is that it was beneficial. And so when the medical industry decided that, okay, this is a popular thing, maybe we should really look into it. So when they did, they also found that it was relatively safe and beneficial for the laboring mother. But one of the reasons why they, of course, were against it is because it was an inconvenience for the way that they had been taught how to birth. And so again, now all of that is changing. And we are finding that water birth is helping a lot of women in a lot of different ways. So what are the pros for mom? It's a reduction in pain scores. And this is information that I'm giving you that has been studied by medical professionals and birth professionals for years now, okay, ever since the 1990s. So we're talking about 30 years of information here that has been proven, okay? So what are the pros for mom? Reduction in pain scores. She doesn't feel as much pain when she's in water, and that's because of the emergence. And we'll talk about the immersions in just a minute. Shorter labor. She's not in labor as long as someone who is on land. So water is actually helping her body in some kind of way. Supports normal vaginal birth. There is a reduction in the need for C-sections for women that labor in water. It also protects against episiotomies, which is a very common surgical procedure that doctors and midwives will use if they feel like mom, quote unquote, needs a little help in opening up the birth canal so that the baby can come through. So it actually protects against episiotomy when mom labors all the way through to full effacement and dilation when she's in water. So that's another good pro. And it also says, evidence also says that it's likely to reduce perineal tears, first and second degree, and also third and fourth degree. Now, there's a little bit of debate about the first and second degree tears. And what they say is in some of the studies, moms in water actually experienced a higher number of first and second degree tears, but they did not experience very many third and fourth degree tears during the labor process. Now, if you know anything about water and you've spent time with water, you know when you spend a lot of time in water, it actually softens up your body tissues of your integumentary system. So you will see like your fingers getting a little wrinkled, toes getting wrinkled, skin getting a little wrinkled. It actually softens you up. So that softening of the body being immersed in water for a lengthy period of time, again, it can be beneficial to where it makes the skin and the body more flexible. But that softening also makes it to where the possibility of tearing could become an issue for some women. So one thing that we do in terms of helping moms with the integumentary system changes is we allow her to get in and out of the water. She doesn't have to be in the water for 12 hours of labor. So we let her go in, especially when she has reached that point of that 4 or 5 centimeters and she's really in active labor and she's beginning to feel those pains. Then we submerge in the water. But then as she goes along and we see her body, her integumentary system changing and her skin softening up, then we encourage her to get out of the water. Let's walk around for a little while, okay? And allow the body to recover a little bit. Because remember, we are not water beings. So when we submerge ourselves in water for an extended period of time, you actually have physiological changes that take place. And we want to bring a balance to that. And that's safe for mom and for baby. Now, some more of the pros and cons for mom is that most women who labor and birth in the birthing pool do so in an upright birthing position. There is no mom that's laying flat down in the water giving birth, okay? It's always in the upright position. And in the natural birthing world, we know, and now also in the medical world of birthing, we know that the upright position is actually best for the woman and for the baby. Another pro is that mom being submerged in water during labor and in birth is she can have a hands-off delivery. That means nobody's sticking their fingers inside of her. No one is, pressing on her body while baby is emerging. And of course, that's a legitimate technique that we use in midwifery, where we actually guard the perineum from tearing by holding on to it. But again, it's a hands-off delivery. And that's what a lot of moms will appreciate too about the water birth process. They also found that a mom that labors in water and gives birth in water has less hospital transfers. And it's easier, she's less likely to be rushed to the hospital for anything, okay? It also says that there are no changes in blood loss, whether a mom gives birth on land, as we say, or if she gives birth in water. There has been evidence that there is no changes in blood loss. It's the same. Okay, they also say that giving birth in water or laboring in water reduces maternal infections. And it also has reduced hospitalizations because some women who birth outside of the hospital sometimes find themselves having to go to the hospital because of different occurrences or infections that may have taken place during their natural births, wherever it is that they were, whether it was at home or birthing center. And women have reported with water birth that they have an overall greater satisfaction of the birth experience. And that in itself is one of the greatest benefits for mom to say, you know what, this wasn't too bad. Because if any of you have given birth before, you know that it is a very stressful, a very tiring experience for some women. And I have heard many women say that is the hardest thing they've ever done in life. So it also, some of the cons. So let's also look at a couple of the cons here. There is a possible increase in genital tract trauma, okay? And that has to do with tears. So tearing of the perineum and tearing of the labias, okay? The labia majora and the labia minora in the yoni area. Again, because those tissues, depending on how long mom has been in the water, those tissues are softening up. And anytime you soften up anything, it becomes easier to tear. So we look at those as possible cons when it comes to the water birth. And so what are the risks? I picked this picture here because this is a complete no-no. Everybody is in the bloody water after mom has given birth to the baby. There are risks involved in open body fluids, especially when it comes to blood, all right? Contaminated water is a risk, and contamination of water can happen with introducing items, and we're going to talk about these essential and semi-critical and critical items that go into the water. We'll talk about those in a minute. But contaminated water is a risk, and it is a risk that has to be taken very seriously because it could mean life or death, okay? Trauma to the birth canal, which we've talked about in terms of the tears, that is a risk. A stalled labor is also a risk. So let's say mom has been laboring in the bed, and so, you know, the pains are getting worse. And so now she says, okay, I do want to go get in the pool. So then she gets in the pool, and then all of a sudden the womb waves stop. And they don't stop for just 5 minutes. They stop for 15 minutes, 20 minutes, sometimes an hour. So sometimes that transition into the water can also stall the labor. So that has to be taken into consideration too. And that's where we get into how the pool needs to be prepared before mom gets in. Mom should never get into a pool that is not all the way filled, and she should never get into a pool that is the wrong temperature for her. And we don't know what the right temperature is because it's going to depend on how mom feels. There is the possibility, again, of internal infection, especially if mothers are allowed to sit in the pool like this young lady is doing after giving birth. No, that's a no-no. Again, we'll talk more about that. And then blood-borne and body fluid contamination is also a risk. So take those things into consideration when you go into the water birthing process. I'm going to tell you a story of Hilda, and I've changed the young lady's name to, of course, protect the family. But there are incidents of death when it comes to water birth. So if you have not taken a class on how to deal with mortality when it comes to the birthing process, I highly recommend that you do so because it is a reality. So this young lady decided that she wanted to have a water birth, and she had a midwife, and the midwife had an assistant, and the midwife, and she also had a doula. And she invited her mother and her godmother to come and witness the birth, but they couldn't say anything. You know, it was one of those restricted environments. She was like, okay, y'all can come, but you can't tell me nothing. You got to be quiet and just sit there and don't say nothing. Okay? So they went on the labor and the birth in the birthing pool and everything. And the thing that happened next is something that should never happen. When Hilda birthed the baby was taken, you know, she did the skin to skin. She was sitting in the pool. And then the midwife and the midwife assistant, They took the baby to do all of the baby's exams and everything. And while they were doing that, they left Hilda sitting in the pool. So her mother was a nurse. And so her mother was whispering to the godmother, they should get her out of the pool. But they promised that they wouldn't say anything. So, you know, they were checking on her and making sure that she was okay. And, you know, they asked her, you know, are you ready to get out of the pool? But, you know, she was like, you know, we're just going to let the midwife and her assistant do what it is that they do. They didn't get her out of the pool. So while she was sitting in the pool, the placenta came out and everything. And, you know, they checked it. Didn't look like any of the piece of the placenta was left inside. And so, you know, eventually after they finished taking care of the baby and getting the baby cleaned up and dressing the baby, then they got her out of the pool. Well, that lengthy time in the pool, especially she started getting cold. And I think when they noticed that she started getting cold and shaking, they went ahead and got her out of the pool. But unfortunately, it was too late. She developed an infection, and within 3 days, Hilda died. The family did not press, the baby was fine. So the baby's being raised by the grandparents. But the baby was fine, but Hilda developed an internal infection inside of her womb from being left in the water too long. So there are incidents of death, and you have to be very careful. If you're doing a water birth for yourself, or if you are helping families with water birth, your number one concern, once baby is out, skin to skin, everybody's looking good, APGAR is taken, get mom and baby out of the water. That is like my number one rule when it comes to water birth safety. So what are the pros and the cons for baby? There are a lot of pros, excuse me. There are a lot of pros for babies because in the studies, they were always comparing babies born in water, babies born on land. What's the difference? So they have found through years and years of study, decades of study, that there is no difference in the odds of infant death. Okay, so the same possibilities of babies being born on land and having a mortality case, there is no difference. It can happen in both places. There is no difference in the APGAR scores. Babies that are born in water have just as good APGAR scores, unless something else is wrong with them, as babies born on land. There's no difference in breathing difficulty. Babies born in the water breathe normally after they get out of the water, just like babies born on land. They have found that there is less of a need for NICU for babies that are born in water. They also saw that there is less need for hospital transfer when mothers who do home births actually labor and birth in water. There is, however, the risk of water aspiration, and that is baby taking its first breath before baby gets out of water. But a good water birth person, a good water birth attendant, already knows you don't leave baby floating under the water. Immediately when baby is born, baby is taken out of the water and put on mother's chest. So the risk of water aspiration is low if you follow that protocol. We don't let baby float around in water. Immediately, baby comes out on mother's chest. And that will solve that risk of water aspiration. There was no difference in newborn infections when it came to babies born in water. Okay, and the theory behind that is that the water, quote unquote, washes away certain bacteriums that a baby may encounter on land. Now, there was a risk of umbilical cord snapping. And in the studies that were done, again, over many decades, they found that there was a higher percentage of babies who had broken umbilical cords that were born in water than there were babies born on land. So you've got to be very cautious and aware of how the umbilical cord is being handled when babies are born in water. So make that mental note for yourself. They also said that there was no increase in the normal newborn microbiomes, okay? And the microbiomes are the bacteria in the water. And there were no difference in the need for resuscitation. Again, that goes back to babies immediately getting out of the water and not possibly experiencing water aspiration. There was no difference in newborn hypothermia. Babies born in water, their body temperatures didn't drop. It was okay. They still maintained their temperatures even though they were born in water. Now, there is a possibility of bacterial infections through the water supply and also through equipment that is used in birth. So what are we going to do to help prepare mom for the birthing process? Okay, we want to make sure that she has on comfortable clothes. Some moms even prefer to be completely naked during the process. But however she wants to dress, make sure that she has that sense of integrity. Because if she has a birth team, and if she's doing a water birth in the hospital, she's probably going to be encountering people that she don't know. And this is where sometimes cultural differences come in, where, you know, a certain religion will require you not to expose your body to certain people. So we want to make sure that mom's integrity is taken into account in the terms of what she actually wears when she gets in the pool. Mom determines the temperature of the water. Some women prefer a nice cool temperature because they're feeling hot, and some require a warm temperature. So the temperature of the water, of course, is dependent on mom, not those that are caring for the pool. It's how mom feels. Make sure that mom is always assisted, even in the water when she wants to reposition herself. So before mom gets in, coach her and let her know, if you want to change positions, just let me know. I'm here to help you. Partner participation is also something that comes into account. Sometimes mom wants dad to get into the pool, okay? And so whenever someone is getting into the pool, we always take into consideration their cleanliness, okay? A lot of times mom needs that support, especially if you're using the inflatable pools. Sometimes the support that mom needs when she's trying to reposition herself or when she needs a little bit of pressure on her back is not there. So that's when, you know, dad getting into the pool with her or someone else getting into the pool with her, whoever her birth partner is, that's where they come into play, okay? Whenever there are health procedures that need to be done. Mom needs to be aware of these things prior to her getting into the water, okay? If she's dealing with the midwife, you know there's going to be a dilation check where fingers are inserted into the vagina. Sometimes the baby's heart needs to be monitored through the process. So it's always best if mom comes out of the water for those things, but if she wants to stay in, then she's going to have to adjust her body in order for some of those things, those health procedures to be performed. And then again, movement assistance. Sometimes moms will be up and down, sitting down, lying down, floating, on hands and knees, hanging over the side of the pool. So again, whenever mom needs to move, especially getting in and out of the pool, you need to make sure that she is assisted and not trying to do that by herself. So in preparing a safe birthplace, here are some things for you to consider and take into account. The right kind of pool or tub. Like in this picture, this is a hospital room that has a birthing pool. Sometimes there are permanent pools and sometimes there are portable pools. The portable pools, often they will use at birthing centers and in home births. And some very important components of a safe birthing pool is the pool needs to be able to have a pump with a hose, an adapter, and a liner. Even the pools that are permanent pools, a liner can be used in those, especially if it's used by so many different people. Okay? So if you are using the little kiddie swimming pool that you've got from the variety store, okay, that is not the most safe and sanitary type of pool to use. If you are a birth professional, you need a professional standard portable pool. Some parents will say, okay, I'm just gonna go get the little kiddie pool, but those are never the most comfortable. For one, you usually can't find some that are deep enough. So I always discourage those, and I encourage parents to go ahead and either rent a pool and buy a new liner, or if you have a very deep bathtub, then you can use that as long as it's enough water in it to create buoyancy. Because mom's butt and hips in the pool is not doing anything for her labor, okay? So purchasing a pool, especially if this is the first baby and you know that you're going to be having more children, yes, go ahead and make the investment. The pools are not expensive now. There are pool companies, birthing pool companies out there that give discounts to birth workers. So again, doing your research on that, and I will give you the name of the company that I send my parents to buy their pools. I can't think of it right off the top of my head, but I'll get to it. So here we are again, preparing a safe place. What are your sanitation protocols? When it comes to sanitation, number one concern is removing biofilm. And that's the slimy film from stagnant water that you will sometimes find in pipes, overflow drains, shower heads, and jets. Some people decide to birth without the adequate birthing pool, and they just want to get inside of their bathtub, okay? But that bathtub needs to specifically be sanitized for biofilm before mom gets in. So those little drain caps need to be taken off, and all of that gook needs to be cleaned from under them. The little side drain needs to be unlatched and it needs to be cleaned and disinfected if mom is going to be using her own bathtub. So all of those things need to be taken into account because that bacteria can cause a problem for mom and baby if it contaminates the water. And you know, most people are not going to go and get spring water to fill a birthing pool. Everybody that I have helped in water birth has always used tap water. So when you are cleaning the pool has to be scrubbed with either a plant-based detergent, if mom is concerned about the natural aspect of what's being used to clean her pool. And not only does it need to be scrubbed with detergent, it needs to be rinsed with water to also remove the microorganisms and debris from the surfaces. Now, just cleaning the pool with a detergent is not enough. You have a second step. Now, after you clean the pool, now you have to disinfect the pool, because cleaning with just regular tap water can also leave certain types of debris on the surface of the pool. So you want to disinfect after you clean. So disinfecting, and the most common and safest type of disinfectant for your pool is going to be alcohol. Rubbing alcohol kills germs, okay? And so you also want to adhere to the dwelling time. So for alcohol, you want to wipe it at least twice, if not 3 times. Wipe it, let it dry, wipe it, let it dry, wipe it one more time, and let it dry, okay? Because you want to be able to kill all of the pathogenic microorganisms that could possibly be left over from your dirty towel that you use for cleaning, etc. All right, so let's look at water immersion. I chose this picture here, this young lady here. I saw this picture recently on Facebook. And you see here, she's not fully immersed in the water. So when we talk about water immersion, but she looks so peaceful, okay? So she's definitely in a zone. So when we talk about water immersion, what is proper water immersion for labor and birth? The belly and the bottom should be fully submerged in water. There should be enough water for a buoyancy effect. And a buoyancy effect means that the water actually lifts the body up a little bit to give it a little lightness in its weight. That's what we mean by buoyancy, okay? Proper immersion produces an increase in oxytocin. You know, that's why water feels so good to us. It actually helps with hormone releases in our bodies. So when mom is properly immersed in the water, her body is actually releasing even extra oxytocins for the birthing process. And here's an interesting fact. When mom is submerged in water for 30 minutes, it produces a hormonal effect in her oxytocin levels that lasts for 90 minutes. Ooh, yes, that's why water birthing feels so good, because of the hormonal effect that it has on the body, okay? Now, here are some precautions. I think we're getting close to the end here. We'll have time for questions. Be aware of gray water, okay, as a possible contaminant. And gray water is water that has come into the pool or the tub from the pipes, okay? And I don't know if you've ever seen pipes, but they're nasty, okay? Everybody's pipes are nasty. So if by chance there is some kind of gray water contamination, you got to start all over. Don't say, oh, that's okay, if you see some gray or black stuff coming up out of the stopper. That's not okay for water birth. You got to start over. Let that water out, clean whatever that area is that that stuff came from, and then start the process over, okay? If you are using a fresh water source, let's say, for instance, if you have well water or borehole water that's coming into the house, the bacterium to be aware of is Legionella. So that is a natural bacteria, but it can cause respiratory system stress. And the person can appear to have pneumonia or flu, and that's possibility for the baby and the mom. So no, you don't want to go down to the river and bring river water up and put it in the pool, okay? Unless you have a disinfectant formula to kill the bacteria that is in that water. Again, we are not natural water birthing beings. This is something that we are doing because we found it to be beneficial for the birthing process. But if you were to take mom down to the river or down to the ocean, you are introducing her and the baby to risk that they should not be exposed to, because water birthing is not natural, okay? So all non-critical items and semi-critical items such as stethoscopes, blood pressure cuffs, Dopplers, pool liners, all of those things should be properly sanitized during the entire use of the pool during labor and birth. So anytime, you know, the midwife has to bring the stethoscope into the water or into the pool area, okay, to listen to the baby's heartbeat, okay, before it goes into the water, it needs to be sanitized. All pool liners, even though they're coming out of brand new boxes, needs to be sanitized. So these are some precautions that, again, you need to be aware of when it comes to water birthing. Now, during labor, you want to ensure that any critical items that are going into the pool have been properly sterilized, and that would be instruments or needles, you know, if mom is having to get a shot or something. But of course, that kind of thing would be up to the midwife. Decontaminate anything or anyone entering the pool. So if dad decides, okay, I'm ready to get in, he needs to go bathe before he jumps into the pool. Otherwise, you have the possibility, and it's not always, but there is a possibility of him risking. So, you know, if he's just getting off the subway and rushing to the birth, and he's just coming out of the gutters in the streets, I would encourage him, you know, go relax yourself, wash up so that you can get ready to get in the pool with mom. And that actually also soothes and calms him down too, okay? You also want to encourage mom to get out of the pool if she has to urinate or defecate. So if she feels the urge to poo-poo, then she needs to get out of the pool. If she has the urge to urinate, she needs to get out of the pool. So urination and defecation in the pool, if that happens, you got to start all over, or either pool time is over if someone poops in the pool or pees in the pool, okay? Avoid black water. That is wastewater containing feces and urine. Again, That's the defecation and the urination. And if there is blood in the water before baby emerges, it's time to get out of the pool, because that could be a sign that something is not right. All right, so after birth, immediate skin to skin, mom and baby should exit the pool as soon as possible. You should not have this kind of situation that you're seeing here, where the pool has turned bloody red because they didn't get mom up out of the pool. Also, after birth, you always want to have on hand dry towels, blankets, sheets, a robe, and dry clothes ready for mom and for baby. Okay, let's go ahead and open up the floor for questions.
Greetings, good morning, Dr. Akuz, Kelly speaking.
How are you?
Finding yourself.
Good.
Don't start. Okay.
Is that my baby girl?
Yes, it is. I'm gonna send her right on to you.